So, why do we plan a health campaign? The whole idea of a health campaign is to promote health. It sort of speaks for itself a little bit, really. And there you can take sort of two approaches, really. You can do a campaign in a preventative measure, and some of you probably will be doing that. How to avoid someone actually getting this problem. Okay. Or it can be for those who have the problem, how to manage it better, how to look after themselves. And with some campaigns, they can be used for someone who's got a long-term problem, you know, how to improve their lifestyle overall. So you can take it from different ways, but the general idea either way is to promote health or maintain health. Okay. It can be to change thoughts and ideas. That's particularly when we looked at things about smoking, healthy diet, you know, improving exercise, those sort of things, to reduce blood pressure or for obesity, you know. So it's about changing thoughts and ideas there. And also the idea for some campaigns, not all campaigns, but most campaigns, is to change behaviours as well. Now, this is particularly relevant when you're dealing with sort of addiction possibilities, like, you know, misuse of drugs, misuse of alcohol, smoking, those sorts of things. And again, obesity if people are overeating or eating the wrong things. But for some people, if they may have got an illness and you actually want to sort of introduce them to some new behaviours, not because there's anything wrong with their behaviours, but just things that they can do to actually keep themselves healthier, then that's actually not changing behaviours, but you might be adding some management measures for them. The general idea of a campaign, again, all campaigns work towards a common goal. So you don't have free-floating campaigns. They're very focused on one particular aspect. Okay. And another thing about a health campaign is it needs to be motivational. You need to bring the audience on board. So it can't be too boring. It can't be too dull, because people just ignore it, really. So that's why modern health campaigns tend to be quite catchy, colourful, you know, sort of quirky, maybe funny. You're able to use, it's a bit different from sort of other health things which tend to be quite serious, but you can sort of use the jokey approach, or, as we know, you can actually use the fear approach, but it's got to be something that motivates people. It's got to be something that either keeps people in the room when you're telling them, or just captivates them to read a little bit more. Okay. Just bear with me a minute. Okay. So how do we begin? What we do normally, you probably have a group of people who get together and decide to plan. Sometimes, if you're a health promotion professional, you might be asked to do small campaigns on your own, so you just need to organise your own space. So we start with an outline which defines the potential benefits. So you will take the topic and you will think about what the potential benefits of doing the campaign is. So some of the ideas which people have come up with. So like Nyakech is looking at smoking, we're assuming generally that the potential benefit that she's going for is to get people who do smoke to either cut down their smoking, or if she's dealing with maybe young people, to stop them smoking in the first place. Okay, so you probably wouldn't do the two things at once. You might, that might be two separate strands of one campaign, or just two separate campaigns, depending on how big you're doing it. But the most important thing is to start with, what is the benefit of what I want to do? Okay. And then you establish the goals and objectives. Now, you need sort of quite large campaigns to do a lot of major behavior change, but you might just focus on, so you might just say, you know, the goal is I'm going to be talking to 20 people. And out of that, I'm hoping that at least 10 of them say that they might want to, you know, they might want to change it, or they might want to have a go at this or something like that. So you think about a sort of fairly specific and achievable goal. So we very rarely say with the first time you approach a campaign, especially if it's a small campaign, that you're going to have a massive change. You're not going to get 100% of people that you come across give up smoking after just one session. But you could say that, you know, you could set a goal that say more people are willing to look into it more, or 50% of them said they're going to make a real effort to cut down or stop smoking. Okay, so make sure that the goals you're coming up with are reasonably achievable, and that's something that we can, you know, you can bring up to class if you're concerned about things like that, and we can talk about it a bit more. The next level is to analyze the audience. So think about who you're going to be talking to. You don't want too wide an audience because you run the risk of missing them all. So you're going to maybe focus your audience group. Think about who this will be quite useful for. And then the fourth point is, what sort of channel of communication? So how are we going to get this information out to people? Is it going to be just information, you know, thinking about our different approaches, or is it going to be some sort of activity group where we're already starting to look at, you know, maybe different behavior changes or behavior ideas? So again, this is where when you're writing about this, or when you're planning this, you bring in the approaches we looked at last week. Okay, are you using the fear approach? Are you using the social change approach? Are you using what, you know? Okay, so have a think about that as a starter, and then you will drill it down. We're going to talk about these things all in a bit more detail. So for the first step, defining the situation and potential benefits, before you do anything, you need to do a little bit of research about what the benefits might be. So you need a few statistics in your plan. Again, I'll go back to Nia Ketch and her smoking. What she'll need to do is put some statistics, find some local statistics about how many people in the country are smoking, how many people start smoking at different ages, depending on what area she's doing. So if she's focusing on young people, stopping them starting smoking, she'll want to do something about how many teenagers are smoking, why, you know, if there's any research on why they say they're smoking. Okay, and the potential benefits are quite easy to find, really. There's not many textbooks that won't tell you what the benefits of not smoking is to your health. So you'll be wanting to put that into sort of the opener. So we need to learn about what benefits your campaign might achieve. As I said, you need to be fairly practical. You need to, for this bit, you need to get some published literature. You need some proper data. Here it says to talk to experts in the field. You might not have the time to talk to experts, but you can certainly search, do a bit of Google searching, picked up data. Most of you are doing subjects that there's plenty written about and studied. Okay, they're all sort of very well-known common issues, common topics, so you won't have trouble finding stuff. You can focus on world statistics, but you can also focus on the local statistics as well. And that could be quite interesting, really. So if it's something that you think you can focus on Malaysia, you can focus on your hometown that you're working in, you know, is the issue for young people smoking, is it quite high in that town, or is it higher in some other places? Or is it that you don't want it to be as high as another town, you know? Or you're just thinking about the statistics nationally? I mean, you do what feels right. But I said, you know, sometimes you can do some local stuff, especially if there's something in your area that's a bit of an issue, that may be an unusual issue that relates to your town and nowhere else, or not so much. And that can be quite interesting as well. So remember, the whole point about this campaign and your presentation of it is for it to be interesting as well for the other people, because health promotion, when we do it, it's always a learning subject. So the work that you all do on your different illnesses will be learning for all of us when you talk to us about it. And these benefits will decide if the campaign's worthwhile. So looking at the topics that most of you have chosen, then, you know, if you can improve the situation for anybody with these problems, or if you're taking a preventative campaign, even if just one of them out of 20 don't do, you know, stop smoking or don't start, then that would actually be quite a benefit. But you might want to talk a little bit about how it will benefit the groups. Current situation. So again, part of your statistic gathering is what's happening now. Okay. So if you think this campaign is going to benefit, again, this is where you find out a little bit. You could also do a little questionnaire with, say, the group. If you're going to do like an educational group with people, you can give them a little questionnaire beforehand, find out what they know. Or, you know, sometimes people, you think everybody knows everything, but sometimes the information people have is not correct. So you know, at the very least, you might be able to change that for them. So some people might have different ideas. With obesity, they might have different ideas about what healthy eating is, or, you know, understanding of diets and things. Sometimes people have some quite crazy ideas about what you should and shouldn't eat. So that could be quite interesting too, if you're doing that. So try to find out a little bit at the beginning. Like I said, you can use a questionnaire. If you've got people who signed up to something, you can actually give them a questionnaire beforehand, or you could do it at the beginning of your session if you're going to have a face-to-face session with them. Diverse motivation. When we talked about the different methods and approaches, we were sort of quite clear that people can be motivated in different ways. What motivates one person to exercise might not motivate another, for example. So you need to consider that diversity, and, you know, find out a little bit about the people who are going to be part of your group, but maybe that could be part of your discussion with them, and find out about what motivates them. Or at least do some research locally. Okay. It's really important. It's really important to sort of think about some people's beliefs and issues that might affect the way they take up your advice. Okay. So if where you are, there's a lot of sort of common beliefs that maybe aren't always correct, but they are local common beliefs. You have to think about how you work around those, and you have to think about how you approach them sympathetically as well, because if you just sort of ignore them or tell people that they're wrong, well, that will alienate people. They won't be very motivated to do some of the things that you're doing. So again, your approach needs to be, even if you're using the fear approach, you still need to be motivational about it. Okay. So you've also got to try and look at your skills of, you know, patience and understanding and a bit of empathy as well, to try to sort of understand why people do what they do. It's quite important. So think about the goals. Like I said, what do you want people to do? You might want them to start doing something like, you know, start a good exercise regime, or you might want them to stop smoking or stop drinking too much, drinking alcohol too much. Or you might want them, you know, they might have, if someone's been in hospital and they've come out and they've had some physiotherapy treatment, or they've had some interventions, say they've had a heart attack or a stroke, something like that. And there are things that they need to keep doing that they might have started them off on in hospital. Well, you might want to find a way to motivate them to keep going, you know, by talking to them about the benefits. If your goal is some sort of behavior change, you need to think about when it might happen. That will be part of your goal. So will so many of them have stopped smoking by 9 months or 6 months or 3 months, or, you know, whatever you want to do? You have to remember, think back to our behavior change cycle that we looked at last week, and bear in mind that you might need to consider some relapse times as that. So, but don't be too harsh with your goals as well. Just because somebody doesn't make it within 6 months, they might do it within a year. How do you know it's successful? How are you going to go and find out? So what are you going to put into your plan to find out? So if you've got say like a smoking cessation goal that's for 9 months time, how are you going to know it's been successful? You're going to touch base with them, you're going to send them out an email, or you're going to put something on social media asking them to let you know, or you're just going to, you know, take all their names and addresses and send out a little questionnaire. Just that needs to be part of your plan, because there's no point having a goal if you can't go and check it. Maybe you'll have another session with them, asking them all to join you again, meet up with you. It's up to you to think about the practicalities of what you're going to do. So the next thing to really think about that's important is, who is your target audience? Okay. And really, the target audience are the group of people that you want to get your messages to. So you might want to sort of sit down and plan who your target audience would be. And to find out who they're going to be, you need to ask yourself some questions and do a bit of research again. So use maybe the research that you did earlier on to work out who your target audience can be. So think about, who are the most people who are affected by this health problem? You know, is it men? Is it women? Is it young people? Is it older people? Is it people who are 60 and above? You know, is it people with children? Just have a good think about that, and think about who the target audience might be. If you're doing prevention, like smoking, drinking, those sort of things, it's often good, you know, that sort of thing is about quite a lot of societal change. So you want to get into people quite young, you know, because the best thing to do with smoking or drinking is to, you know, encourage them not to do it in the first place. So if you did, you could have a target audience. If it's smoking prevention, you would definitely hit teenagers, you know, because that's that difficult time when they make a decision whether to start or not, really. And, you know, whether it's fashionable or not fashionable, whether their parents do or don't. Lots of things to think about, really. But otherwise, if you're dealing with older adults, you're probably thinking more about sort of smoking cessation, really, rather than prevention. If you're dealing with some people who've had strokes, they will tend to be an over 40 sort of group. So, or even if you're dealing with people who you want to prevent having a stroke, you probably wouldn't be looking at teenagers. You'd be thinking people more in their 30s, 40s, really, about, you know, getting their health into gear to avoid, because they're the people who start to worry about that sort of health thing. You don't tend to worry about it when you're on 20. Let's be honest about that. So you've got to think about the right group that thinks it's worth. Ikram's going to be looking at mobile phone use. Now, we know the highest users of mobile phones tend to be young people. So, you know, he might want to take it from approach, you know, maybe with a school class or something like that, to think of ways that they can manage their, you know, because you won't get them to give it up. So there's no point having that sort of target, because we know that's nigh on impossible. But really a target of sort of, you know, safe and comfortable usage, and bringing parents into it as well. There is also an issue with mobile phones about young men in gambling as well, because there are a lot of gambling games on the mobile phone. So if you wanted to work with an older age group, you could sort of look at that, especially if you know people who do it. They might be willing to do a little group with you or something like that. Okay, so again, think about who the target audience are. So young people with gambling games on the mobile phone, which is a big issue at the moment. It's in the UK. I don't know if it's so big with you in Malaysia, but in the UK, it's becoming one of the big health issues, because gambling, although you think, well, it's just a financial problem, it's not, because it becomes an addiction. So it actually affects people's health when they can't gamble, or when they're not managing it very well. They have stress, anxiety, but also the financial issue, sort of spending so much money, has knock-on effects, which will affect their health, you know, because they end up lying to their families, and they may drink as well, just to try and avoid all these horrible feelings. So it can have quite complicated health problems, as well as the fact that if they overspend, they don't even have the food to feed their families, or pay the bills, pay the electric bills and things like that. And therefore the family suffers as well if they're the breadwinner. There are lots of complicated things to think about. But again, so if you were doing sort of gambling on a mobile phone, you wouldn't go for the under 18s, because they aren't allowed to do it. So your target would be adults, and you might consider adult males, because although a lot of women are doing it now as well, but you looking at the statistics, you might do something like that. So get your statistics first, and that will help you decide who your target audience are, whether you're doing prevention or whether you're doing management afterwards will again affect your target audience. And then we do something called segmentation. Segmentation is something that comes from advertising, really. And you actually break people up into different segments of the population, subgroups with particular characteristics. And, you know, if you've got a big group and you want to narrow it down, you might narrow it down into some of these characteristics: behavioral, cultural, demographic, physical, psychographic. And the behavioral one is the people who all do the same thing, people who behave the same way. So again, if you're doing gambling on a mobile phone, they'd all have that sort of slightly addictive personality. It could be a physical issue, people who, you know, whose bodies don't always, you know, aren't always the fittest looking, so it's quite easy for them to put on weight. You know, you get your endomorphs and your ectomorphs. People who are just naturally skinny don't put on that much weight, have health problems, and people who, you know, put on weight quite easily. So if you're doing obesity, you might want to look at that demographic. Like older women after hormone changes put on weight very quickly and find it very difficult to lose it. There's a sort of physical issue there. Cultural as well. There's no point focusing an anti-drinking campaign on people whose culture don't approve of drinking. There's a lot of complications. I'm not saying you can't do it, and I'm not saying some people don't drink, but there's the cultural issues you have to deal with as well. So if you were a seasoned health promotion professional, that would be fine. You know, you would do something very special for a group of people who drink against their culture, because it's quite a complex process. When you're dealing with them, it has to be done in, you know, you have to be quite secretive as well. It has to be very confidential. I wouldn't suggest you take it on a challenge like this just for this assignment, because it's just too complicated, really. So you would do drinking in a culture that wasn't sort of a non-alcohol culture. Now, you know, if it's a Muslim culture, you know, you don't expect people to be drinking that much, so you might not get enough people for your group. Demographics, you need to think about what's happening in your area. Like I said, if there's a particular issue in your area, well, that can be quite useful to do a characteristic. There's no point doing something that doesn't happen in your area, because you won't get enough. So like I said somebody could do malaria from your group, because you're living in Malaysia and malaria is an issue there, and you would find people to work with. It'd be quite difficult for me to do it here in the UK. There are people who suffer from malaria, mainly because they've lived in other countries. I mean, it's not indigenous to this country. So I'd have a lot of trouble going to find someone. So it's not a topic that I would choose. So, you know, look at your demographic, really. Okay. Yeah, that's covered most of it, really. So then, I mean, once you're putting your audience together, really sort of have a little think about what they're like, really. So you need to analyze your audience a little bit. And think about how it's best to reach them. So again, when you're doing something with young people, very young people, how do you think, what's the best way to reach young people? Say young people aged 13 to 20. What's the best way to reach them? Social media, yes. Quickest way to contact young people, social media. How do you talk to each other? WhatsApp groups, TikTok, Instagram, yes, am I right? So if I wanted to do something with young people, especially about mobile phone use, what would I do? I'd probably do something through social media groups. What about older people? Would that always be the right way to contact them? Say people over 50? How do you think you'd reach them? What's another way? They might work with something a bit more formal, yeah? Email, yes, maybe, but also maybe leaflets, you know, handwritten information with pictures or something might work better for them. Maybe picking it up in a public place like a library or in the shopping centre or something like that, you know, with a stand. You might reach older people, communicate with older people better that way. So you need to think about how you reach people, and then also thinking about the differences, how you motivate them. And that's going to be about the language of what you do, really. Okay, you'll speak, if you were motivating a group of young teenagers to stop smoking, you would use different language than you would if you were working with a group of people over 50 who'd recently had a stroke and who were, you know, trying to get healthy again. You would lose different language to them as well. Okay, so the youngsters, maybe a bit more casual, try to use some of the phraseology that they understand, as long as you don't look too uncool doing it. You've got to, you know, do it right. And with older people, maybe a bit more formal, a little bit more respectful, depending on who you're talking to. you know, and asking proper questions and giving maybe some more researched answers. And that will help you choose your approach as well. So again, those of you, when you're looking at your topics, now is the time to think about, have a little think about who your groups are going to be, who you're going to aim this at, and then think about what sort of approach am I going to take. As I said, we did approaches last week, so you could start to think about that type of approach. And then into that type of approach, what sort of activity would work for this group? You know, again, with young people, you can't do anything that's too long and too boring, because, you know, they won't come really. It's got to catch their eye. There's got to be something in it for them, really. Older people sometimes are more willing to commit their time. It might be an interest of theirs, so they will come along. So you might be able to do like a discussion group with them, you know. Young people might want to prefer to do some sort of activity thing. And then think about how you're going to collect your information. There may be some databases that exist at the moment, but that for you, that wouldn't be open, because any existing databases would be part of, say, for me, for the NHS or the, you know, your local health service. You wouldn't really have access to them. So I would put the database aside, but think about how you're going to get information from them. Will you do some interviews with them? Will you do some questionnaires? Will you just do a chat group where you pick up general ideas? Or will you do some sampling? Will you just ring people up and get yes, no answers and things like that? So a few things to think about there, and these are the important things. You might want to get information before, and you might want to get information afterwards. So think about how you would do that. Again, would you do it differently with young people and maybe with older groups or professional groups, things like that? So bear in mind that. So there's quite a lot to think about and plan, isn't there? So why do we need to target the audience? Because your strategies have to focus, and they've got to be focusing on the right group. You need to get to know about your audience and how to reach them. You need to understand them and understand their behaviors or the way they react to things as well. And if you're not sure, you might want to talk to other people who have experience of different groups as well. So someone might be a group leader at a local community centre that might give you some ideas about how to approach people. I know a couple of you work in clinics. You might want to use people in the health clinic. You could either use fellow professionals who work there, or you could ask the clients who are there if they, you know, if they want to be involved. But to do that, you would have to get lots of permissions from the place where you work. So there's things to think about there, but it's fine. It has been done before. Some of you who work with young people might want to use your knowledge of the groups that you work with to maybe do something that's very much focused around them. And you can use your general knowledge and skills there. As I said before, I had some people who taught, and they worked with their teaching group, so they knew them quite well, and it was quite easy for them to set up some sort of little games with them, really. All the knowledge that you gather will help you decide if you're choosing the right approach. But if you're not sure, you can discuss it with other people, and of course you can discuss it with me at any time. You can either use some time when we're in class here, or you can also send me messages on our WhatsApp group, and I'll give you advice as well. So don't worry about that, because you've never done this before. I'm not expecting you to be perfect about it, but what I would say is ask the questions of me beforehand, rather than go all the way down the long way of sort of developing something, building something, and it not working out the way you want it to. And if it means you just avoided asking me a question before, well, I will give you the advice, tell you whether it's worth doing or not. So we're thinking about the channels of communication. And you need to decide again on what approach you're going to use. So you've got your approach, and then the means of communication must relate to your approach. So when we talked last week, and some of you said you might, you had a bit of a practice, and you said you do the fear approach, just as an example, then the means of communication need to reflect that approach. So you're going to do your nasty posters or frightening posters or bright, coloured posters or hard-hitting language for the fear approach. There's no point deciding you're going to do the fear approach and then do a nice poster with lots of smiley people saying, well, why don't you come along and all that, because that's just not really going to hit it, really. So you need to think about the best channels for your campaign. And as I said, some of you, if you want people to come along, you might need to do some posters, or you might use social media. Consider what channels your target audience uses and trusts. Like I said, if it's young people, they don't really look at anything else unless it appears on their phone, to be honest. If it doesn't appear on their phone, they don't want to know. So you have to have a way. If you were inviting young people to a group, you need to put something on Instagram, for instance, or you might even do a fun video on TikTok if you're up to it. Okay. You need to make sure that the channel of communication that you're going to use will reach the size of group you want. Now, what I would suggest to all of you, because this campaign is a small campaign and it's only part of your assignment, that the size of group I would work with is fairly small. Okay, so that because you are not a practice health promotion professional, sometimes they do campaigns with people that runs into thousands. You can't do that. You don't have the capacity, you don't have the time, you don't have any funding. So you've got to do it quite small and keep it sort of within your community, really. So, what number you decide is probably a bit more limited than what one would normally do in a health promotion campaign, but that's okay, because all you're doing is trying to learn the skills of doing it. Okay. You don't have to be, super successful. You just need to learn the skills of doing it, because the most important thing is probably the last part of the criteria, which asks you to identify, how you can do it better next time, what went wrong, what was good, what was bad. So really, and you need to check with people. Did you see my poster? Did you see, did you think it was good? Get a bit of feedback from them. Don't be worried if they say, no, I thought it was horrible, because again, all you're doing is learning. Okay, you don't have to be right. You just need to learn. So, as I said, it might be tempting to just get it out there into hundreds of people, but really just focus it. Here I've said use channels like magazines. Of course, that's getting a bit tired now, but health promotion guys do use magazines quite a lot. If it's a woman's health matter, it's it's not unusual to find it in a woman's fashion magazine or something like that. But again, that takes lots of funding. It's not something you can do. But like I said, a small, if you're doing young people in the school, just something locally to the school or something to the class might work, or a little poster in the classroom might work. If you're involved in the message, so it's not, normally you wouldn't get someone else to do it. I know with some big health promotion campaigns, they might even use very experienced advertising groups. They do that for big national campaigns, but they also have to try and get them involved in the message as well. because sometimes these guys don't always understand what you're trying to deliver. And that's why some advertising campaigns for health cannot be as effective as others, because it means the advertising company didn't really get on board with the purpose of it. And the general feeling is more involvement means more attention to detail. So for this exercise, don't farm this out, do it yourself is what. You can get some help. There's nothing wrong with you getting any help with this. You won't lose marks if your brother's a great artist and has done the drawings for you. Not a problem. You don't even have to tell me that. It's not a problem at all. If you want to make your group some immediate family members, because you're used to them and you're used to interacting with them, and if you can find something that all your family members are interested in out of your topics, then it's fine, or if you can get all your little nieces and nephews together to talk about mobile phones, that's fine as well. I don't have a problem with who you use. Obviously, if you're dealing with anyone, if you're doing any work with young people in schools, some of you may well be connected to schools or community centres, just make sure you get permissions, really, or permissions from the school head, or if they're coming to a special activity that's outside of school time, you need to get family permission as well, okay? So, just, again, if you're unsure, check in with me. So the best chance of making a difference is to use more than one channel. So instead of focusing on one poster on one wall in one place, you need to take that into a couple of different places. And just to think about what sort of restricts people. Some people have different communication patterns. Some people like visual things like posters. Some people just like word of mouth, being told. So you might think of different ways of doing it. But again, still don't lose the focus on your target audience. But your channels can change. Like I said, lots of people work differently. People's culture may also affect the preferences, really. So if you're focusing, again, leaflets, they've got to be in different places. So somebody culturally might want to go to a cultural centre, then make sure there's leaflets there. They may not go out to the local library, or they may not go to the pub or something, whereas other people might do. So you could put them in somewhere like that. So because, again, for smoking, good place to put them is a local bar. If people want to give up smoking, they're often smoking and drinking tends to go together. It can be quite useful. So just think about that and try to be creative as well. Okay, here's your planning cycle process. Okay, so if we start at the top with identifying the need, all planning processes are pretty much the same. Identify the need, assess what that need is, how big it is, what the level of need is. Identify, coming out of that, then identify who your target groups are. Maybe focus on the key issues. If you've got a huge subject like depression, Elsa's doing depression, there's a lot there. Are you doing the knowledge thing? Are you working, aiming at people who've got depression, how to sort of alleviate it or live with it? Are you doing something about for people how to recognize depression and to go and get something done about it, or how to recognize it in a family member? Think about what those key issues are, and then can you do all the key issues in one training, or are you only going to take one aspect of them? And that would be fine. Analyzes what are the causes, what are the contributing factors. So What are the things people should and shouldn't do to manage this health issue? What are the aims and objectives for your session? What do you want to do? Do you want to change something, or do you want them to just know something, learn something, if you're going to take the educational approach? Create an action plan in the middle here. So before you actually do your intervention, create an action plan. And it's this action plan that you're going to be presenting in your presentation. You're going to be telling us all about the information you've gathered, all about your thoughts about how you're going to do it. Okay. And then you're going to do it. Part of your action plan is think about what sort of obstacles and risks. So what could go wrong? Sometimes you don't know everything that's going to go wrong. That's the way of the world, isn't it? But do think about what obstacles and risks, what could go wrong, what might be a problem. You know, can you find the room? Can you find the space? Can you find the right time? Will people come? Will nobody come? You know, have a think about that, really. Will you not get permission to work with the young people? All sorts of issues. So you might have to think about a different way of doing it. And also identify in your plan what sort of resources you need. Now, this is hypothetical. So, you know, we don't have any funding to give you. So resources cannot be high. So there's no point saying I want thousands of pounds for this, that, and the other. But you might, there would be sort of things like hiring a, you know, hiring a room in a hall or something. You might want to put that. And if you do want to do that, you might not be able to. So you might sort of want to find out if there's another way that you can do it where it's not costing you anything. You know, is there some centre, or is there a group of people that you know that get together anyway? Or can you do it in your lounge? You know, things like that. After you've done the intervention or carried out the presentation, carried out your plan, be it a session, be it something online, be it making a leaflet, be it, as I said, an educational session, be it an exercise class that you've started. Just get some feedback from people. So if you wanted to do some sort of physical intervention, like show people the sort of, say, dealing with obesity, you might want to do a session where you have a little chat about healthy eating and then show people some sort of easy exercises that you want them to carry on. You only have to do it as a one-off, really, and then you could sort of think about, are they going to carry it on themselves, or would they like to come to another class? Would you signpost them to a gym? You know, think about those sorts of things, really. And gather your feedback. So get some feedback from them, even if it's, oh, I enjoyed the session, thank you for letting me come, you know. So think about what sort of feedback you want. Are they going to carry on doing it? You know, what are their views of it? Did it work for them, or would they have liked you to have done it differently? Nothing wrong with getting that. Don't feel worried about asking them, and try to get them to be honest too, because it could be quite helpful. And that you'll put into your evaluation, okay, which is the part 3 of the task. As I said, the evaluation, the sort of things you'll be looking at, which you don't have to discuss in your presentation, okay? Presentation is only what is your plan, what is your process, how are you going to do it? The evaluation is something that you do later when you hand in the written part of the assignment. The evaluation goes in there. I'm going to talk you through that in a minute. And the evaluation, we'll be looking at things like, how did it go? Did anything go wrong? Did you achieve your goals? Or you may not have achieved them, but, you know, has there been some achievement, or are there some steps towards achievement? What did the audience think? You know, did they enjoy it? Were they did they think it worked? And you then reflect on, would you do it again if you wanted to do this campaign again, would you do it in the same way, or is there something that you'd have done differently? So remember, this is the learning part of the assignment, really. And it's that evaluation that's going to really add to the marking for me as to how much you really understood the process. Okay. Okay, so we're going to talk about the assignment requirements now, and we're just going to go through some little bits about what you have to do. As I said, the final assignment is up. You'll see it on Google Classroom. Okay, it's there for you to look at whenever you want. Now, there's a few written tasks, and I'm going to talk those through with you, not today, but another time, okay, because we'll get to those afterwards. But the task that we're focusing on is task 4. And as you can see, there are 3 criteria. 4.1, produce health promotion material for a target audience. 4.2, deliver a small health promotion campaign. And 4.3, analyze any effects of the campaign. Okay, you need to be clear that for task 4, the word count is only relevant for 4.3. So make a note of that, please. So 4.3 will be handed in with the rest of the written assignment. And that's your analysis that I was talking about earlier on, you know, like, did it work? Did it work? What went wrong? What could have been done better? That sort of thing. You've got the 300 words to do your 4.3 analysis. Okay. Included in that presentation will be what material you've created. Now, some of you may choose to create a leaflet that goes with your campaign. Some of you may choose to use a poster that goes with your campaign. Some of you may choose to do a video that goes with your campaign. Okay. And if anybody's got any other ideas that they would like to ask me, that's fine. But at the moment, we've got poster, leaflet, video. They're the ones that most people have used before. And you will show that at the beginning. If it's a poster, you can put it in at the beginning of your slideshow if you want. Posters usually work. If it's a leaflet, you can possibly show it in your slideshow, or you can give us some idea about it, okay? Or just pull it up on screen and show it to us. If it's a video, obviously you'll just run it at the beginning of your campaign, okay? So you'll show me your piece of health promotion material, and then you will do a slideshow which you will talk over, and that will explain to me your background planning and the ideas that you have. Okay, so I'm going to say goodbye to you then. Now you've got lots to think about and lots to do. Okay.
Bye.
Bye all. Remember, you can always message me if there's something you're not sure about. Okay.
Okay, thank you, teacher.
Okay. Bye.
Bye-bye.